Root cause analysis. For more videos, visit my Facebook page, Healthcare Quality. Root cause analysis should be done for the following incidents at a minimum: all confirmed transfusion reactions, all serious adverse drug events, all significant medication errors, all major discrepancies between preoperative and postoperative diagnosis, adverse events or patterns of adverse events during procedural sedation, adverse events or patterns during anesthesia, other adverse events, for example, healthcare associated infections and infectious disease outbreaks, and all other defined sentinel events. The root cause analysis tree shows burns, strains, and cuts as the direct causes of injury, and apparent causes could be behavioral or conditional, but the root causes are usually different. An example of a sentinel event: an inpatient received 2 units of the incorrect type of blood. At the time the patient's blood was drawn for a type cross-match, the sample was mislabeled with another patient's name. The transfusion was given to the patient whose name appeared on the type cross-match lab report, not the patient whose blood was in the lab specimen vial. Results of the analysis. The root cause of the event was the poorly designed system for labeling laboratory specimens. If not corrected, this problem could cause other incidents. Root cause analysis steps. 1. Gather the facts. 2. Choose a team. 3. Determine sequence of events. 4. Identify contributing factors. 5. Select root cause. 6. Develop corrective actions and follow-up plan. This shows the event flow diagram. On the left column, we write the date and time in a chronological way. And on the right column, we describe what happened. Team members discuss the sequence of events till they all agree about what really happened. This initial step gives all members of the team the same understanding of what occurred and helps avoid differing interpretations of the same event. Visit the site of the event and observe activities with the root cause analysis team to confirm your understanding of the process. Work with the process owners to confirm your flow diagram. This figure illustrates the second tool in root cause analysis, that is, the cause-effect or fishbone diagram, where the effect is put on the right side of a big arrow from which arises branching arrows about the different categories of causes of the effect. It helps the team to brainstorm all possible causes of the problem. With the assistance of a cause and effect diagram, root cause analysis team can uncover chains of causal links that will lead them to the root causes and contributing factors of the problem, and allow them to implement effective barriers and solutions. This is an example of cause-effect diagram in which the effect was rise of temperature in hemodialysis patients. The causal categories were patient, people, place, and procedure. Then comes the different possible causes in main or branched items as shown. Then we come to the third tool used to discover and validate real causes of the problem. This is called the 5 Whys, developed by Taishi Ono of Japan's Toyota, who trained his workers to systemically trace errors or problems back to their root causes through a problem-solving process. It's a team process requiring all those knowledgeable about the process under investigation to participate. The team keeps asking why until the root or primary cause is discovered and validated by the group. Before the why question can be asked, each event in the sequence must be identified like steps in a process. Then the causal factors can be identified by answering why questions about each event in the sequence. The root cause or causes will be discovered by consensus of the team based on their understanding of the interaction of events and the causal factors contributing to the occurrence. The following example demonstrates the basic process. My car will not start. This is the problem. Why? The battery is dead. Why? The alternator is not functioning. Why? The alternator belt has broken. Why? The alternator belt was well beyond its useful service life and has never been replaced. Why? I have not been maintained my car according to the recommended service schedule. And here is a hospital example. Question 1. Why did the new surgeon perform the procedure without the approved privilege? Answer. Because the operating room did not have the privilege control sheet. Question 2. Why was there no privilege control sheet? Answer. Because the OR did not receive it from nursing department. Question 3. Why did nursing not provide it? Answer. Because they did not receive it from the medical staff service. Question 4. Why did nursing not receive it? Answer. Because medical staff services did not receive a signed temporary privilege sheet from the chief of the staff. Question 5. Why didn't medical staff service not receive or obtain the sheet? Answer: because the chief of the staff was unable to return it before the office closed. All solutions of the problem must focus on the methods used to process temporary privileges, specifically the review and signature process between medical staff services and the chief of staff. The 5 whys exercise helps narrow the field of possible causes and helps the root cause analysis team focus on the most important parts of the process. At this point, the team can identify a root cause, an unreliable, time-limited repository for temporary privilege control sheet in a 24-hour, 7-day system. The corrective action involves selecting a repository that is convenient and always available, as well as communication and follow-through process that work. Another key process issue to be evaluated during the analysis is why the surgical procedure was permitted even though there was no validation of the clinical privilege. When this issue is confronted by the team, question 2 changes to why was the procedure permitted without the control sheet? In some hospitals, centralized sterilization prepare packages for surgeon by name according to privilege sheet. An acceptable and credible root cause analysis contains the following characteristics. The analysis focuses primarily on systems and processes, not on individual performance. The analysis progresses from special cause in clinical processes to common causes in organizational processes. The analysis probes to deeper levels by asking why questions repeatedly. The analysis identifies changes that should be made in systems and processes, either through redesign or development of new systems or processes that would reduce the risk that such events will occur in the future. Root cause contributing factor statement. After you have developed an understanding of what occurred and why it occurred, the next step is developing root cause contributing factor statements. Clear and specific root cause and contributing factor statements will lead the team to a more accurate depiction of the events with a focus on system-level vulnerabilities. These in turn will prompt the development of better actions and outcome measures. Now the question is that, do root cause contributing factors meet the following criteria? 1. If corrected, reduces likelihood of adverse event. 2. Meets the following rules of causation. Rule number 1 clearly shows the cause and the effect relationship. A wrong statement: a resident was fatigued. The correct one: residents are routinely scheduled for 80 hours work per week. As a result, the fatigued residents are more likely to misread instructions, which led to an incorrect tube insertion. Rule number 2: use specific and accurate descriptors for what occurred rather than negative and vague words. A wrong statement: Poorly written manual. The correct one, the training manual was not indexed, used a font that was difficult to read, and did not include any technical illustrations. As a result, the manual was rarely used and did not improve performance by the equipment operators. Rule number 3. Identify the preceding causes, not the human errors. A wrong statement: the resident manager made a dosage error. The correct one: due to no automated software to check the dosage limits and no cognitive aids on dosing, there was a likelihood of this dosing error, which resulted in 3 times the appropriate level of insulin being ordered and administered. Rule number 4. Identify the preceding causes of procedural violations. A wrong statement: the technicians did not follow the procedure for CT scans. The correct one: noise and confusion in the preparation area and production pressures to quickly complete CT scans increase the probability of missing steps in the CT scan protocol. This resulted in an air embolism by inadvertently using an empty syringe. Rule number 5. Failure to act is only causal when there is a pre-existing duty to act. A wrong statement: the nurse did not check the stat orders every half hour. The correct one: the absence of an established procedure for nurses to check the stat orders on the printer created the vulnerability that urgent orders would not be administered. This resulted in the bolus of antibiotics not being administered. Actions. Actions are the critical component of the root cause analysis and present challenges for the team. Strong actions are viewed as those that are more likely to be successful in accomplishing the desired changes, rendering greater utility for the effort expended. Note: you may need multiple actions to address a single root cause contributing factor. This is an example of the action plan form used, where the contributing factors written sequentially on the left, and in front of each we write the risk reduction strategy, persons responsible, action due time, and status that shows if that action was accomplished or not. We should ask ourselves whether actions meet the following criteria or not. 1. Address the root cause contributing factor. 2. Are specific and concrete. 3. A cold reader understands and can implement. 4. Will be tested or simulated prior to full implementation. And 5. Process owners were consulted. Outcome measures provide us a confirmation that what we hoped to accomplish did in fact occur. A well-designed measure will document the effectiveness of our change. This illustrates a framework for an action plan, with measures of effectiveness put in front of each action item. The ideal outcome measure should measure effectiveness of the action, not completion of the action. Is quantifiable with defined numerator and denominator. Define sampling strategy and the time frame for measurement. And set realistic performance thresholds. Thank you.